Hello, everyone. I hope you can hear me. So my name is Sharina Walker, and I'm a Community Engagement Coordinator on Dolly's team. And as Kirsten mentioned, I work with community-based organizations funded to do COVID-related outreach and education, RAP support, and contact tracing. But more specifically, I also work with many CBOs serving people with disabilities. And one of the fabulous organizations that I have the pleasure of working with and learning from is our first presenter today, Northwest Disability Support. So Northwest Disability Support is doing amazing outreach and education work, including creating the Fighting COVID book that many of you have seen and love. And if you haven't seen it, I'm hoping you'll get a sneak peek today and you will love it, I promise. So it is an honor for me to introduce Executive Director Angela Jarvis Holland and Director of Operations and Programs Angela Fromm. Angela and Angela, I will hand it over to you to talk more about yourself, the partnership with OHA, and the COVID outreach and education work you've been doing over the last many months.
So next slide. And next slide. I'm Angela Jarvis Holland. There's two Angelas, and anyone that hears us on the phone or over Zoom or whatever will know that I'm the English one, and I'm on the right in this photo. I came to this work, I'd been a nurse in England and also been a community health promoter and then a community change activist. And I had two kids that bring me to the work, and one of them experiences Down syndrome, my son Dan. And I'm the executive director of Northwest Down Syndrome Association and All Born In, which are under the umbrella of Northwest Disability Support.
And I'm Angela Fromm. I'm the program director with Northwest Disability Support. And Angela and I have had the pleasure to walk alongside each other for almost 20 years now. I have three kids that bring me to the work, and I also have the privilege of working alongside some of our pretty incredible support team, which is listed below. Maria Rangel, that does our bilingual outreach support. We have Will and Kate that do our community youth coordinator and directors, as well as Mindy that does our web and communication and visuals. So thank you for being here with us today.
Jamie, would you like to just introduce yourself? Jamie's doing our tech support, but she's a very important face-to-face worker with our community.
Hi, I'm Jamie Burch. I'm Projects and Community Coordinator, and I do work around Think College for students with intellectual disabilities, our socials, and just all of the projects and community work that we do. I provide a lot of support for that. Thank you.
Next slide. So we're parents of people with significant disabilities, and our staff include people with disabilities. They include people with developmental disabilities. We're advocates, social justice warriors, and people that, like everyone that comes to this work, we're people that care deeply. And the fact that we're part of our community and live the experience, we feel, is one of the things that makes the work powerful. And it's the same for a lot of the CBOs that you're partnered with.
And our home base is in Northeast Portland, and we serve over 5,000 families and professionals across Oregon. We are also run two coalitions and host the All Born In Cross Disability Annual Inclusion Conference and UDL Conference for over 600 people. Next slide, Jamie.
So I was looking at the mission of Oregon Health Authority. I often, like in times of crisis, and as we were trying to reshape our work during COVID, I go back to my mission statement. I go back to what can I stand on, what endures. And it was really refreshing to see this mission statement from OHA that names our community, that names all the communities that the disability community intersect with. And our mission is to create and nurture a loving and inclusive community that celebrates every person with a disability, including Down syndrome. And our All Born In cross disability work, we're really pursuing a more inclusive civil society and the empowerment of people and the voice of people with disabilities being raised. Thank you.
In our work at Northwest Disability Support, we've been working for years creating accessible visual health resources in partnership with many that also reflects the voice of our families that we serve. We have our new parent outreach books we trans-created, and that is in English and Spanish. We have our Healing Heart books and Counting Chromosomes, as well as many more accessible, durable resources. Next slide, Jamie.
So it didn't get off to a great start with us in our partnership with the health world and COVID. And also in the education realm. I think people are reactive at the time of the start of a crisis, and there were great doctors and hospitals, and there were others that fell back on some ableist thinking and were asking, for instance, do not resuscitate orders for anyone coming in from a group home, or considering how they would ration ventilators. And that activated our community. And it also caused a lot of fear at a time where we were already in fear, because the risk of COVID is significantly higher in some of the homes and families that we serve and support, including my own. And that had us working on the Senate Bill 1606, which is a health equity bill. And I'll say that OHA very quickly joined around that work. But this starting point is like a traumatic entry for us, the same as I think the Black community has a history. It's important that we name problems when we see them, and then we get to work on solving them. Next slide. And that's just a hello from one of our lovely children, Violetta. Next slide. So Senate Bill 1606 passed. We worked on that, and we'll leave, there's a link that you can look at your leisure, and there's just a little description of it there. I'd like everyone on the call to know, if they come across anyone with a developmental disability, to tell them they do have a different set of rights to be and with their person if they're in hospital, and support them. That was a huge moment for us, and we are appreciative of everybody else that advocated alongside us to make that happen.
Next. So for Northwest Disability Support, we were heavily involved in, we gave testimony to the bill, we gave input, shared the voice of our community as well, and we shared at the local, state, and federal level. We worked hard to create an accessible resource that we could get in the hands of family members and providers and people that were supporting individuals with disabilities. The information is really hard and dense to dig through, so we wanted a really quick, accessible way. And thanks to the funds of OHA, this went out to over 5,000 people on our list, as well as being able to be shared electronically. And as we all know through this COVID experience, not everybody has internet, and not everybody has an accessible way to access information. Next slide.
Next slide. Next slide.
And as Sharina kindly introduced, at the beginning of the pandemic, we wanted a way, our youth and families were telling us they wanted to feel like they had a place of power, that they were finding ways that they themselves could be active in fighting fighting COVID. We partnered with Dark Horse expert and artist Shannon Wheeler, as well as Martin Thomas, who is a colorist. He doesn't live in Oregon, but he is an incredible colorist. He's also an African-American activist. I'm going to do a little walkthrough of our comic book, but the exciting news is this has been distributed to over 44,000 people. And what we've heard from our partners and families is this has been one of the first accessible hands-on resources that people have had access to. So Jamie, if you could pull up, please. Okay. So just going to do a quick little visual walkthrough. We wanted a very beautiful, graphically depictive way that we could get the voice of our young people out into the community. And this is not a resource that is a disability-specific resource, but it's a resource for everybody. Jamie, could you go to the next page, please? It just so happens.
Sorry, Angela. There's a place for resources that can be customized within that too when there's larger orders we use.
So as you can see, one of the main characters, experiences a disability, and our youth were very helpful, and as well as the trans creation that Maria supported with the Latinx community around color and style and words and pictures. The youth said, we want the wheelchair to look like a wheelchair that we would see out in the community. I want to have cool gloves. There was a lot of fear and anxiety, as we all know, around COVID-19 and what that means for people and what are safe ways that they can try to protect themselves. Jamie, could you move to the next page, please? And as we know, a lot of fear, young people were, and also as Angela spoke about the Senate bill of people, and the SB 1606, there had so much fear about going into hospitals and not being able to be supported, and not a lot of accessible information. So we wanted a way for people to show, that you can wear a mask, social distance, wash your hands. So did a little bit of myth busting and also just graphically showing appropriate measures. Jamie, next page, please. We created again, this is in English and Spanish, not translated, but trans-created. So we have two versions. This is a hand washing page that is in both, and it is a tear out, and we also have permission from the artist to share it for dissemination. People are using this in their kitchens and their bathrooms and schools. That is a good graphic visual walkthrough of appropriate ways to wash your hands. Our young people were also saying, what's 6 feet apart? What does that mean? What's far enough? And our youth said, well, everybody's different sizes and shapes. What about if we said 2 pool noodles apart, 2 lightsabers apart? Next page, Jamie. This is one of our favorite pages too, because we were thinking of, our young people were feeling like, well, there's so much that we can't do, and we wanted ways for them to feel like there were things they can do. So you can, we can still joke, we can sing, we can dance, and I still love you. It talked about ways that people could find a trusted person to talk to if they were feeling sick. We also knew from our youth that there was a lot of fear around telling somebody they were sick because they might be separated from their families if they had to go into hospital. Next page, please. It also showed what it might look like if you go to get a test. You might be in a car, you might be in an office, you might be in a hospital. There's lots of other things that people can not feel well from. Doesn't necessarily mean it's COVID, but again, just that reminder to have a trusted person that you can get support. And as far as we know, it's the first person in outer space that uses a wheelchair. So our visual graphic here. So next page. So through this, we all know that we are all actively being superheroes and fighting COVID. And at the bottom here, it shows, together we will fight COVID. At the bottom of this page, whoops, go back down, Jamie. This is also each community, based on numbers orders, are able to customize this resource page to get vital information out to their communities. And we do know that these have been handed out, at testing sites, food banks, and whatnot. And this has been a good way for CBOs to connect. As well as you can see at the bottom, there's some images. Our youth did a physically distant photo shoot where they all wanted to be superheroes and find ways that they can protect their families as well. Jamie, if you could move to the next page. And again, this is just a final reminder of the 3 steps: wash your hands, socially distance, and wear a mask. And this came out, it is an actual comic, so it comes out in the true form, and these were mailed out to started out to over 5,000 on our mailing list, and like I said, we are now at over 44,500 sold and distributed, thanks to the partnership and support of OHA as well as many other partners, and then Brink also was a key supporter in helping us navigate. Next slide, please. So again, this is a hard copy durable resource that we are able to share out with the hand washing pages. Again, it's in English and Spanish. It's downloadable. And if anybody has more questions about how they can purchase copies of the comic, my contact information is at the bottom of the page here. We also want to just do a quick shout out to Dolly and Sharina that have been our wonderful thought partners and just really coming to the table with a very teachable spirit and all around. So we're very grateful for this opportunity to be here with you today and for what we've learned and along the way.
So our staff, we're all impacted by COVID, and we have all different things going on. And Maria is fabulous. She was already working with us on a Breaking Barriers grant from the feds to create more accessible education. And we've added to her resources and time. But Maria doesn't work in the mornings, and we needed her voice. So she's done a short video for us to share today.
Hi, my name is Maria Rangel, and I'm the Bilingual Programs Coordinator for Northwest Disability Support. One of my biggest passions is to help break barriers of access for our Hispanic Latino community. Being a Mexican mom of 3 children, and one of whom experiences a disability, I myself have found it challenging when trying to access information that is in my first language that also acknowledges my culture. Making sure that our Hispanic Latino community has access not only to information in their primary language, but also to information that is presented in a respectful way that acknowledges the culture, and that we are also meeting people where they're at, wherever they're at with their learning starting point, is very important to us. When our team works to create a resource in Spanish, we don't just grab our English resources or trainings and translate them, but instead we build them from the ground up to make sure that we're bringing high quality information and resources that are also culturally competent to our community. Everyone has the right to access information in a way that they can understand, which is why it's so important that we really go in depth when we're creating our trainings and information that are going out to our community. We want everyone to have the information they need to make informed decisions for themselves and for their families. And today, I just want to thank everyone at the Oregon Health Authority for supporting our community through our partnership. Thank you.
Maria hosted a session in Spanish, and it was a Q&A session, but she did want us to tell you that Dr. Joe Sullivan, who'd worked with OHA and had actually been our family doctor for 18 years in the past, gave about 6 hours of his time to deconstruct and reconstruct, really based on what the community needed to make a really interactive session. So next slide, Angela, please, Jamie.
And both of these sessions were done around understanding the COVID-19 vaccine. This session was done with our youth director, Kate, and Dr. Joe partnered to bring this information to youth with and without disability. Again, he spent probably 5 or 6 hours doing pre-planning, asking for videos, questions, really wanted to sit with the community to make sure that this information was accessible and digestible. And there was also some dancing and a lot of fun. This was a chance for folks to understand and discuss the myths and truths around the COVID-19 vaccination and ask and offer resources to support. Next slide, please. This is
Can I just say, I think that there is a disability culture. There isn't, it's not always acknowledged or recognized. So we try, there's a different cultural competency. And I think we'd like to offer that we're always open to discussions about what does that mean to be culturally competent for the disability community. And it fits with what you're about to address, Ange.
And a practice that we have is always visually capturing the voice of people with developmental disabilities. We walk alongside people, and all of our work is curated in that way. This is a graphic facilitation. This was an example that was done from the session to graphically capture what were the hopes, fears, concerns around the COVID vaccine. And again, this is a practice that we use very often so that we aren't speaking for people with disabilities, but with people with disabilities. Next slide, please. And our Kate is our social justice youth developer. And then, like I said, this is a group that's available for youth with and without disabilities. It is not a disabilities topical group specifically. These are youth that are passionate around the environment, homelessness, race, not just disability. So we invite any youth that would like to come be alongside. It's a pretty great experience. Next slide.
This is, we're trying to share stories out as much as we can. And we were we were there first as one of the impacted communities. So we've got a lot of stories, and we're in a lot of discussions with OHA about how we're going to help with the Safe and Strong work and the Healthier Together work, because people need stories as well as they need facts. So this was just a little video that we shot, but when we were getting our vaccines.
What's your name?
Dan, Jarvis Holland,
And what's your birthday?
April 23rd, 1999.
Thank you so much. Perfect. All right, nice and relaxed. You got this. So all you do, you make sure the log is correct with this. All right, guess what? You are vaccinated.
Good job, Dan.
Hey, it's my favorite color, green.
Oh, good. I'm glad I chose green. We have pink too, but
I'm not a pink person.
not a
green.
pink person. All right, good luck. You guys can pull around.
More good things to come. The next episode of the comic will be beating COVID. The vaccine's giving us hope and whatever. Next slide.
This is one of our families that joined in. We were grateful for the loving partnership with Brink and the Safe and Strong campaign. Violetta was the little superhero. This is her family participated in one of their upcoming campaigns.
Yeah, and I just will close on, as you're looking at the resources, Healthier Together and Safe and Strong means we've all got to be together in this work. Dan calls us a vaccinated wolf pack. There's a small group of us with families with disabilities who are almost at that 6-week magic number where we'll be able to be together. But more than that, it means we're not fearful of hospital or death. And we're 100% committed to partner, and anyone that wants to reach out to us in that vein, we're with you. And thank you for all the hard work everyone's doing.
Thank you, everybody, for having us today. Be well.